Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
Welcome to Health Watch presented by UMass Memorial Health Care. We're talking about food labels. There's a lot of information contained in them, and that can be confusing, but it's also important for your health.
The first thing to remember is that food labels are there to guide you into making healthy choices. But the most important thing for you to do is really figure out what you're looking for yourself. So, for example, if you're trying to lose weight, you might be looking at the calories on a food label. If you have hypertension, you might be looking at the sodium content of a food label. So the first thing to do is really define what you're trying to get from that food label.
Nutritionists say what's on the front of the package is just as important as what's on the food label.
There are certainly some words that are on the front of a food label that have actual legal meanings. For example, the word organic actually means that that food is certified organic. So it's grown without pesticides, it's grown without, or if it's an animal product, it doesn't have growth hormones in it. There are certainly some words on the front of a food label that mean essentially nothing legally. So you can say that a food is natural, and that actually doesn't have any sort of legal meaning. So a consumer will look at the word natural and think, oh, this food must be good for me, but really it doesn't mean anything. The word light, for example, on a food label actually has a legal meaning. So the word light means that the food has 1/3 fewer calories or fat than the typical version of that food. So you can actually trust that word light to mean something.
When it comes to the contents of a food label, less is better.
Foods that are the healthiest for you, you have to remember, are not even going to have a food label. So fruits, vegetables, lean proteins, things like chicken, ground beef, they don't even have food labels because they only have one ingredient. Other foods, when you're actually looking at a food label, you really do want to look for an ingredient list that's short and easy to pronounce.
Nutritionists say the serving size and percent daily value are key to a healthy diet.
When you're looking at a food label, the first thing I want you to look at is the serving size. Now that's different than the portion size. Your portion size is what you yourself are eating. The serving size is just a tool that you can use to do some math. So for example, if the serving size is listed as 8 crackers and you eat 16 crackers, you're going to have to multiply all of the calorie values on that food item. People sometimes get confused when they look at the protein or calories or fat because they're not really sure how much of those things they should be taking in per day. So that's where the percent daily value really comes into play. When you're looking at something like calories, for example, the number doesn't mean very much if it's out of context with how much you should be taking in total for the day. So if you look to the very right of the food label, you'll see sometimes it will say percent daily value or percent DV. If a food has a percent daily value of 5 or less, you can assume that that food is low in that nutrient. So if your food says sodium, 150 milligrams, and that's 5% of your daily value, that's a pretty low sodium food. On the other hand, if your percent daily value is 20 or more, you can assume that that food would be high in that nutrient. So for example, if your bread has 21% of your daily fiber in it, you can assume that that's a high fiber food. I know that label reading can be really confusing, and sometimes the more you look into it, the more confusing it seems. What we really want you to do is pay attention to some basic aspects of the food label. You want to pay attention to portion size so that you're not eating too much at one time. You want to pay attention to calories so that we can make sure you're eating enough throughout the day, but not too much. It's really all about balance. The additional things you can pay attention to would be eating enough protein to reduce cravings, reducing your sugar intake, again to reduce cravings but also increase energy, and reducing your sodium intake.